Hi guys, this video is going to talk about range of motion assessment. So, what is range of motion? Range of motion is the range through which a joint can move or be moved. Range of motion testing is performed to determine whether the range is limited, normal, or excessive. The goals of the assessment is to determine the end field of the motion and to determine whether there is a pain present in that motion, and if so, the location, quality, and intensity can be located. So, the tools that have been used in order to measure the range of motion is goniometer. So this is how goniometer looks like. It comes in different shape and size.
Come in the way of blocking her hip flexion. If it's blocking her hip flexion, then we're going to put her arm above her head. Her left leg is going to be doing the flexion, and her right leg should be laid flat. So now we're going to see the greater trochanter of her femur. So now we have to palpate. In order to palpate, we have to do internal and external rotation, which is easier for the palpitation. So now we're going to do about hip extension. So please place a pillow underneath the abdomen to prevent back injuries. So I'm doing this voiceover even though Shahida is occupational therapist. Now we're going to palpate the greater trochanter of femur. As you can see, she's having hard time finding where's my greater trochanter. So you have to internally and externally rotate your leg to find where's the greater trochanter of the femur. Then you place your goniometer on your femur and you do the hip extension. So now we're going to talk about knee flexion. So we're going to palpate her greater trochanter of femur and her knee joint. Once she has flexed her knee joint, we are going to put the goniometer on her knee and calculate the range of motion. dorsiflexion. The leg has to be placed 90 degrees on a flat surface. The goniometer is placed at the ankle joint. Doing plantar flexion. As again, the leg has to be placed 90 degrees on a flat surface. The goniometer is placed beside the ankle joint. So now we are going to do ankle inversion. As you can see that you have to put your feet 90 degrees to do the inversion. Oh my god, such hideous nails. Girl, you gotta get a pedicure. So now we're going to do ankle exertion. As before, the leg has to be placed 90 degrees and has to be faced outwards for exertion.
There are 5 types of conditions that needs precaution. The first one is in painful conditions. The second one is in the presence of an inflammatory process in a joint or the region around a joint. The third one is in patients taking medication for pain or muscle relaxants because patient not be able to respond appropriately and movement may be performed too vigorously. The fourth one is in the presence of marked osteoporosis or in the condition where bone fragility is a factor. Perform passive range of motion with care or not at all. The fifth one is in assessing a hypermobile joint. That is all. So now we are gonna talk about contraindications. The first one is therapist suspects subluxation, partial dislocation of fracture. The second one is if myositis ossification, which is a piece of bone in the muscle, or ectopic ossification, which is a bone forming in the tissue, is suspected or present. The active range of motion and the passive range of motion should not be undertaken without first ensuring the patient is assessed by a professional who has expertise.